will be continuing with the topic of types of suppository bases, which is in continuation to our ongoing series on suppository dosage form. Having discussed the nature of synthetic fatty bases, under which we have looked into two examples, which is Vitapsol and Suppository, we will talk about the various merits of such bases. First and foremost, it is very advantageous as mentioned that these are saturated in nature, and because of which their tendency to rancidify is less. So, that is the major advantage over cocoa butter suppositories. The second advantage is that it does not exhibit polymorphism on heating. The crystal properties are retained and the difference with different crystal forms or the change in physico-chemical properties is not observed, because of the reason that on heating and cooling it is a stable kind of a base. The next merit is it has good water absorbing and emulsifying property. So, all the qualities which we have quoted go in the favor of a stable and a very effective kind of formulation. So, synthetic bases are preferred for the reasons mentioned. They also have a very small melting range. This is a very advantageous aspect, especially when we have to incorporate insoluble nature drugs. As the melting point range is narrower, on melting the drug gets dispersed and the solidification happens very quickly and the drug uniformity in dispersion remains maintained. So, for that reason the dose effectiveness becomes better and the potential therapeutically is effective. They also have an advantage that they solidify rapidly and have enough of shrinking capacity. Now, as already mentioned, that shrinking ability should be better, because whenever the molds are opened and the suppository has to be withdrawn, the lubrication point can be avoided, because when it shrinks it loosens itself and on gentle push from the end of this mold would help the suppository to loosen its connect with the held mold. But if the lubrication is avoided, this will also help in less challenges with the drug release. The major advantage is this melting point does not get affected when the temperature variation shoots up accidentally or intentionally, and also it is not affected by a fat soluble substance which goes into the base. And the most advantage is aesthetic point of view, they are white in color, smooth in appearance and odorless. So, all the disadvantages which we saw with cocoa butter has been taken care with synthetic fatty bases. So, that is the reason in today's time synthetic fatty bases are preferred, especially when it is to be mentioned to be used for rectal administration. So, talking about next type of bases, which is hydrophilic bases, as the name quotes, it is water loving in nature. So, we have drugs at times which need to be into water loving capacity for its dissolution and release into the body cavity. So, oleaginous bases are not recommended when such drugs have to be inserted. So, when the challenge is to insert a water soluble drug, we prefer going with hydrophilic bases. Now, hydrophilic bases have an advantage that they are not dependent on the body temperature. Their drug release is because of the dissolution. So, here the drug release we can call it as dissolution rate limited phenomena. So, the drug comes out as a function of dissolution rather than melting. So, if the patient is suffering from fever where his body temperature has a variation, in such cases the bases of hydrophilic nature formulated suppositories are recommended. The next merit of using hydrophilic bases is because of its higher melting point, the problems of compounding, handling or storage can be taken care of. I just quoted an example that India being a tropical country, sometimes we see variation in temperature. The temperature is lower during winters and higher during summers. So, such challenges would not be seen when we are handling hydrophilic bases, because here there is no concept or effect of temperature on the preparation or handling or administration or be it storage of dosage form. The hydrophilic nature is very favorable for drug release, because Majority of the hydrophilic bases have water loving tendency, and the drug being soluble in nature gets out of the held base very effectively. Under hydrophilic bases, we have the first type, which we refer as water soluble bases. As the name itself indicates, they are water lovable and they go easily into solution when they come in contact with water. It is a very advantageous statement. Under this type, we have two classes, one being called as gelled glycerine bases and the second type being macrogol bases. When we talk about gelled glycerine bases, now glycerine is nothing but trihydric alcohol, and it's more in the polarity chart and they go miscible with water. So glycerine is also having an advantage, that is emollient. So it soothes the mucous membrane of the rectum. So this is also an advantage, that it does not cause irritation or discomfort to the patient when they are inserted. Now the base is glycerine. Now glycerine is gelled either with soap or gelatin to give firmness and also to have emulsifying properties. Now that is the reason it is called as gelled glycerine base. Now such bases produce base of desired viscosity or softness or stiffness. Now if you want little more thicker consistency, increase the quantity of gelatin, and if you want it to be more softer, you can reduce the quantity of gelatin. So that is how the consistency is manipulated or customized as per the need. Second merit is it is water soluble, and because of which it goes into solution with the body fluids easily. So that is gelled glycerine bases. Now if we talk about the composition, it contains 91% of glycerine, which is a trihydric alcohol, and it is brought into a gel consistency which is semi-solid by addition of either a soap, which could be 9% sodium stearate. Now this composition is official in United States Pharmacopoeia and it is used generally as a hydrophilic base. Now these are generally recommended to be used for laxation purpose, when to be given in rectum for evacuation of bowels, or also it is recommended in vaginal therapy, especially when there are challenges with vaginal treatments or infections which infect vaginal area. We prepare suppositories which are based on gelled glycerine bases. Now the limitations with using these bases are hygroscopicity. They are highly hygroscopic in nature. Now hygroscopicity, the disadvantage is it takes away a lot of moisture. So when it is inserted in the body cavity, it has a tendency to take lot of moisture, and because of which the dryness which occurs on the rectal mucosa, it may lead to irritation, and that is due to the dehydration effect due to water retention by the suppository base and leaving the mucosa irritable. The major challenge is storage. Now these are again, because of its hygroscopic nature, they do not show good shelf life. So when they are not stored in an appropriate temperature conditions, the problem is they may take in lot of moisture from the atmosphere and also bring in changes in their physico-chemical aspects. So because of such limitations, we have other options which we will be learning further. Now gelatin also is incorporated in such bases, as it is called as gelled gelatin bases. Now gelatin has a challenge because it does not gel along with large number of drugs. So it is an incompatible combination when we bring in tannic acid, ferric chloride. Now these are the medicaments which are added for some therapeutic benefit for purpose of insertion into the body cavities. But when we are taking such a base which has gelatin in it, gelatin will create incompatible problems when such drugs have to be administered. So it is recommended that you have to overlook or you have to overcome this incompatibility or change the base when you are incorporating tannic acid or such drugs which are incompatible combinations. The next challenge is that the preparation of base is time consuming. So it is not a ready to use base, it is to be first prepared and the consistency has to be adjudged as per the need, and also you need to have a problem to be overcome, that it has a tendency to stick to the molds. So, this again becomes a disadvantage because when we are releasing the suppository from the mold, slight excess pressure may bring in deformity, and if there is no defined apex on such a dosage form, it loses its purpose and it becomes very challenging and difficult for insertion into the body cavities. So, patient compliance would be less and withdrawal symptoms would be more. They also have the problem that they are liable to microbial growth. Gelatin is being attacked by a lot of microbes. So, when we incorporate gelatin for bringing the right consistency, it also invites problem of showing microbial contamination if not taken care. The preparation method is not molding. Of course, molding can be preferred, but the challenge being that it does not show good shrinking ability. The mass is generally prepared using hand rolling. Now, hand rolling is a very traditional method which does not give you a very aesthetic appeal of not having very uniform view when you go from one to the other suppository. So, hand rolling we will be discussing the process under methods of preparation, but this mass which is used as gelled gelatin base, the method generally adapted is hand rolling. Talking about the second class of bases under water soluble bases, macrogol bases. Now, macrogol bases you must have come across when we have discussed the chapter on ointments. Now, macrogol bases are more recommended and preferred over gel gelatin bases. Now, these macrogols, which are generally polyethylene glycols, or we generally call them as carbovaxes. Now, these are used for preparation of ointments very commonly, but also they can be used for preparation of suppositories. Now, why are they used for in suppositories is because of their nature. These are polyethylene glycols. As you know, glycols are diols, two hydroxyl groups. So, they are glycols in nature which range from liquid state, semi-solid states to waxy solids. Now, based on their molecular weight, we have different states of matter. Now, when we bring these different states which are liquid, semi-solid or solid and mix them in different ratio permutation combinations, we can achieve a combination or a base of desired consistency and a desired physical property. So, the next merit which I am quoting here is that the physical properties can be customized. So, physical properties, be it melting point, be it hardness, softness, we can play around and tailor the needs as per the demand, and by mixing different polymeric forms, I mean to say the molecular weights. For example, I have quoted one here is PEG 1000 grade, you take 96% and PEG 4000 4%. So, when you mix these two waxes in the defined ratios what is mentioned, you will get a suppository base as you desired for your product. Now, there are certain important considerations whenever we are using macrogol bases. Though it has a lot of advantage, but there are certain considerations or certain highlighting aspects which one should not overlook while using them. First and foremost is their hygroscopic nature. This is a common factor which we saw with the previous type under water soluble bases, that is gel gelatin bases. Now, hygroscopicity is something which is challenging, whether be usage per point of view or from storage point of view. So, because it has a tendency to draw a lot of moisture when it is within the body or outside the body, it is difficult. When it is within the body and it draws more moisture from the mucosa becomes dry, and when mucosa becomes dry, it causes irritation. Long irritation may also lead to abrasion of the mucosa, and rather than curing the disease, it may bring in more challenges. And when it is outside the body, that is when it is on the storage shelves, if it withdraws moisture from the atmosphere, it loses its tendency and it loses its shape. So, it is not advisable that this hygroscopic nature be not taken care of. And to order to minimize the discomfort which is going to be caused on the rectal mucosa, PG suppositories are generally moistened before they are inserted into the vaginal or rectal cavity. Now, here you cannot do it by the patient on its own. Here you need a nurse or a medical practitioner who can help and insert the product or the dosage form into the body cavity. So, first the product has to be wetted, moistened, and then it has to be inserted into the body cavity to overcome the challenge of not withdrawing water from the rectal area. The next important consideration one should keep in mind is incorporate 10 to 20% water into the base. So, when you are formulating a suppository and you have taken a combination of different molecular weight PGs, you need to understand that add 10 to 20% water in your formula and prepare the base, so that when you are formulating the final form of the suppository, it will have enough of water within the formulation and it will prevent mucosal irritation. And also it becomes very important, because you have 10 to 20% of water in your formulation, you can incorporate water soluble drug with lot of ease. So, that is an advantage, and also a point to ponder, that whenever you are preparing suppositories using macrogol bases, these consideration would be of interest. Now, having understood that it is of more benefit as compared to the gel gelatin bases, we also have to highlight what are the merits of such bases. The first and foremost merit is they have high melting point. So, when they have high melting point, their handling becomes easier, especially in countries like India. So, in a tropical climate, this kind of suppository bases are recommended, and the pharma industries prefer such bases in order to formulate a stable suppository formulation. The second advantage is they possess good solvent property. Now, when I mention good solvent properties, they can take in lot of drugs into solution. So, when lot of drugs get into solution, you have a broader array of medicaments which can be inserted through rectal administration. So, whenever a patient is bedridden and he is not able to take other routes of administration, rectal route can be a choice, and you have an advantage through macrogol bases to deliver a variety of drugs through rectum or vaginal route. The next merit is, in the presence of small amounts of fluid in the rectum or vagina, these bases soften and release the drug. So, it is not necessary that the drug will be coming out of the suppository base only when the rectal fluids are larger in volume. So, this limitation can be taken care by using macrogol bases. And the last example which is of interest is, because of their high viscosity, the leakage from the body is reduced. So, when leakage is less, patient compliance is very much increased. So, leakage property should not be entertained, because patient, even if he is on the lying down state, he would not appreciate that the leakage causes him discomfort. Talking about aesthetic qualities, they are attractive because of their clean and smooth surface. So, when you hold it in your hand, you get a good feeling and it becomes patient compliant, so that insertion is very smooth and it will not abrade the surface while inserting. And also the main advantage from a formulation aspect is, you can either prepare by molding method or by cold compression method. Now, we talk about molding, which is a traditional approach, and cold compression is a modern approach. So, this base has an advantage that if you have an facility of using it on a mold, you can prepare it or take it to a sophisticated machinery. When you are going on a scale up level, you can go for equipments which help in compressing and generating the suppository dosage forms. They also have the ability not to undergo hydrolysis, neither they become rancid, as they are stable when exposed to light and air. So, they do not have such challenges which we saw with the first type, that is oleaginous bases. The most important aspect being physiologically inert. When they get into the body, they are inert, they do not show any action on their own. So, they only are carriers and they carry the drug within them, release the drug at the right time, at the right site, and they themselves have no action. So, this quality of being physiologically inert is a very advantageous aspect when we use them as suppository bases. and above all they do not support microbial growth. So, for a formulator, his interest is to prepare a stable, effective and a broad spectrum formulation. Now, having understood the merits, there are certain limitations which go along with macrogol bases. To quote some of its limitation, first and foremost, as already mentioned with hydrophilic bases, generally of their hygroscopicity. Now, hygroscopicity is a term which comes often and pops up again and again under hydrophilic bases because they withdraw water from the mucosa and causes irritation. So, that is one of the major challenges while using macrogol bases. Next disadvantage or limitation is they have tendency to form complexes. Now, though it is water loving, but at times it ends up making a complex formation with certain drugs which will slow down their release. So, now this is contrary to our aspect which we said that it helps in releasing water soluble drugs because of its water holding capacity and water loving ability. But sometimes it could be a challenge because of the formation of certain complexes which are not very much water soluble. Then at times you also observe fractures. Now, fractures may develop on the surface of the suppository. Now, these fractures develop because in common words we call them as cracks. Now, they develop because of water loss. So, if they are not stored in the appropriate temperature conditions, the water evaporates from the formulation and leaves crevices or fractures on its surface. Now, next disadvantage is macrogols are incompatible with number of drugs, especially tannins, phenols and also sometimes when they are stored in plastic containers. So, this becomes a challenge because at times if you are not taking care of, tannins or phenols may avoid its release when they are gelled with macrogol bases. Now, having understood the first type of water soluble bases, we have second class under hydrophilic bases which we call them as water dispersible bases. Now, water dispersible bases includes generally a common term which we call them as non-ionic surfactants. We study about non-ionic surfactants elaborately under multiple types of dosage forms. So, when it comes to suppository bases, these non-ionic surfactants can serve as suppository bases too. To quote examples, we have very general examples, tweens and spans. Tweens are hydrophilic and spans are lipophilic. So, already having understood biphasic dosage forms and having discussed about emulgents and emulsifiers in our previous lecture series, we have discussed about tweens and spans elaborately. So, my recommendation is that in order to learn about tweens and spans, you need to go back to your biphasic dosage forms and look into non-ionic surfactant class. So, under suppositories, though they are recommended, but they are not very preferred class because they basically are used as self-emulsifying agents in water which help them in forming soft, bulky and non-irritant emulsions. So, they can be used, but their main purpose is not as a base, but as self-emulsifying agents, and in order they are incorporated along with other ingredients so that they help in drug release and also once the drug is released in their uptake in the body. So, drug release and drug absorption. Now, in general when we talk about water dispersible bases, which is the second category under hydrophilic bases, we study about them because of their certain merits which is temperature stability. So, when you look into tweens and spans, we are not talking much on it because they are more of emulgents. They have a good temperature stability aspect, they are very good with drug compatibility. So, when and where you have challenging drugs to be incorporated into a suppository dosage form, only then we look into this aspect of using the water dispersible bases. They have a good microbial resistance, they are not prone to microbial attack. Of course, they are non-toxic and non-greasy. So, when they are non-greasy, they do not cause discomfort or leakage. They also have good molding ability that is, they do not stick onto the molds, and when they are used by manufacturing by molding capacity, they come out easily. And the last and most important being that they have increased contact with mucous membrane, because of which the holding time or the absorption or the uptake of drug from the mucous membrane is increased. So, this is about water dispersible bases. Having learnt about different types of bases, a formulation is not complete when other additives are not added. When you are talking about holistically a suppository formulation, of course, the selection of type of a base is a critical parameter, because that is the carrier. So, having understood different types and options available under types of bases, it is also important to know what are the other additives which generally go and help in formulating a stable suppository formulation. To quote some additives which are apart from the base selection is addition of a non-ionic surfactant, addition of a soothing agent. Now, soothing agent could be a glycerine or propylene glycol, that is either a diol or a triol, as it is very obvious that having understood types of bases where we are talking about gelled glycerine bases, so they have dual purpose not only as the base but also as a soothing agent. So, it is wise for a formulator to select such ingredients which have purpose which is beyond one role. We also add oil soluble antioxidants, especially when we are using oleaginous bases because of their rancidification problem. We add certain soluble antioxidants, examples being butylated hydroxytoluene, which we abbreviate as BHT, and butylated hydroxyanizole, BHA. We also add sequestering agent such as citric acid, ascorbic acid, because these are helping in avoiding oxidation and overcome rancidification. And finally, we also add preservatives, examples being benzoic acid, sorbic acid or their salts, and the most common type being combination of methyl and propyl parabens. Dear students, having understood what are the other additives to be added along with a very critical aspect of selection of a right suppository base, one can achieve a good, stable, effective dosage form in a suppository shape. And it is recommended that when a patient compliance is our priority as a formulation chemist, we need to understand what are the choices and which will be the right choice based on the need, based on the purpose and based on the occasion when a suppository dosage form is to be inserted. So, for further reading, I would recommend you certain standard books as recommended in the syllabi, that is Dispensing Pharmacy by Cooper and Gunn and Dispensing Pharmacy by R.N. Mehta. So, in the next series, next lecture, we would be touching upon methods of preparation of suppositories and evaluation of suppositories. Happy learning. Thank you.